know, the government doesn't need to hold an online consultation to find out that the voluntary system isn't working. All they need to do is open a newspaper. Today we see another story of hospitals in Quebec paying significantly more for the chemo drug paclitaxel because there's a shortage of it. The minister has said if a voluntary system isn't working, she'll move to mandatory reporting. So will the minister finally acknowledge what we've been saying all along and now introduce mandatory reporting for drug shortages?
Hear, hear.
The Honourable Minister of Health.
Mr. Speaker, as I said, the voluntary system is working to a certain extent to ensure that those drugs are posted and that we are aware of what drugs can be used to replace them. But the member has to recognize that these consultations are important because not all drug shortages will be fixed through mandatory reporting. It can be a much more complex issue on a global scale in terms of the kinds of shortages that we have seen. So we are working very closely with the provinces and the territories and the drug manufacturers to make sure, whether it's voluntary or mandatory, we're addressing drug shortages.